From the campus of the University of Nebraska at Omaha, consider this with Cathy Wyatt, a program of issues and information behind today's news.
Weight loss. For so long,
I felt stuck. But Zepbound means change. Zepbound is for adults with obesity to help lose weight and keep it off.
I got the power of 3. I lowered my A1C, CV risk, and lost some weight.
Adults lost up to 14 pounds.
I lost some weight.
Mounjaro helps your body regulate blood sugar and can help you eat less food. People lost up to 25 pounds.
Once weekly Trulicity is proven to help lower A1C, and it can help you lose up to 10 pounds.
With Wegovy, I lost 35 pounds. And some lost over 46 pounds.
Hi everyone, I'm Cathy Wyatt. Welcome to the 29th season and this week's edition of Consider This. Our topic, healthy weight loss. Joining us to talk more about it are UNMC's Corrigan McBride and Allie Deering-Anderson. Dr. McBride is the Division Chief of General Surgery, MIS, and Bariatric Surgery. Dr. Allie is a clinical professor in the Department of Pharmacy Practice and Science. Thank you both so much for being here and welcome.
Thank you.
You bet. Dr. McBride, I want to talk first with you.
Okay.
How do you define being overweight?
So there are several different ways that it is looked at. Probably the most commonly used is body mass index, but that is because that is an easy math calculation to do. So doctors like it, insurance companies like it. But what it's really trying to get at is when you are heavier than you should be, there is fat deposited in your body where you don't want it to be. It can deposit in your heart, it can deposit in your liver, and that is what makes you unhealthy. So what we really should be defining it as is your percent body fat. We know what is a normal percent body fat, and it is different for men versus women. And as your percent body fat goes up, meaning you have more fat in your body than muscle or bones or anything else, that's when you start becoming unhealthy. So overweight is somewhere above a BMI over 25 or a percent body fat in the upper 20s if you're male or the lower 30s if you're female. And if you keep accumulating fat, then you become obese. So obese is a BMI over 30 and a percent body fat in the low 30s for men, high 30s for women. But it's not about any of these numbers. It's about having fat where you don't want or need fat to be and where the fat actually makes you unhealthy.
Okay, so what percentage of people are we talking about here?
So depending on which cutoff you're looking at and what category you're looking at, it is estimated that somewhere around 30% of Americans are obese and 70% of Americans are overweight, meaning they are carrying at least a little more weight than they should to be unhealthy.
Wow, contributing factors, what's causing this?
The list is as long as my arm. There's a genetic component, there's a dietary component, there's definitely a socioeconomic component. If you live in an area with no grocery stores and the only thing you have access to is fast food, that plays into it. Medications play into it. Unfortunately, lots of the medications sort of in that mental health arena contribute to weight gain. So people are trying to get healthier from a mental health standpoint, and their medications, they're actively sabotaging their weight maintenance and weight loss efforts. Lack of physical activity and exercise. If you live in an area where it is not safe to walk down the street, me as a doctor telling you you should walk for 30 minutes a day is not a realistic goal. So all of these things contribute and to play into it. You know, for many, many years, we used to hear about, it's all about calories in and calories out. And it is much more complicated than that. It is about your genetics, it's about your medication, it's about your metabolism, it's about your access to food. And there are some studies that show it's related to the insurance that you have. If you are on state-sponsored insurance, you're likelier to be heavier than if you have commercial insurance through an employer. And so it is a very, very complex issue.
A new year is a very popular time for people to consider shedding a few pounds. Before we even take that first step, what do we need to know?
I think it is very common to want, set your New Year's resolutions, make a new plan, think about something. In all of the studies, the single best diet is the one that works for you. We all know people that have been successful with keto or with Atkins or with Weight Watchers or with simply restricting their portions. But unless it is a change you can make that is sustainable for you, affordable for you, you are not going to be successful in the long term. So don't just go on the internet and Google the best diet and try to change everything in a single day. You want to make small, incremental changes that are sustainable for you and your lifestyle in the long term. And that includes the foods you select, how you grocery shop, how you cook, how often you eat out, if you do eat out, where you choose to eat out. All of that needs to play into the changes that you think you can make.
Okay.
And why those are different than the changes that will be successful for someone else.
All right, so healthy eating and being active, very, very important. I will admit, when we walk down this path of, wanting to make a change, it can be overwhelming in a hurry. So when you say to kind of take it in smaller increments, let's say there's somebody watching right now who says that sounds really, really good. So give me a case in point kind of thing.
The first thing most people recommend is really evaluating how much fast food you eat, how much you eat out, how much processed food you eat. If you look back at portion sizes from 30, 40 years ago to portion sizes today, the portion sizes are much larger, particularly at restaurants. And so most people will do better if they are eating home-cooked meals at home. Home-cooked, of course, at home. But they are eating things they prepare. They are controlling the portion size. They're controlling what's in their foods. I remember years ago when I learned that most Italian restaurants put sugar in their tomato sauce to deal with that occasional bitterness that comes from a tomato. I don't know anyone who puts sugar in their homemade tomato sauce. So when you make it, you have control of the ingredients. Yeah. You can control how much fat is in it. You can control the source of the fat. You control whether there's those secret sugars being put in. But so the first thing I would say is really look at how much you're eating out and how much processed food you're eating and looking at portion size and where you're getting your food.
Okay. I want to talk activity really briefly here because I do think we get to a new year and people are like, I'm all gung-ho, I'm going to do this. And maybe they get out and instead of starting to walk, they start to jog or they start to run. And then they get burned out and think, oh my gosh, what have I done? So you've talked about the eating portion. Now talk about how we would ease into some activity.
So physical activity and exercise are incredibly important for our cardiovascular health, but they don't play nearly as big a role in weight loss as the gym industry would want us to believe. They do, on the other hand, physical activity and exercise helps with weight maintenance. So if you've been successful in getting 20 to 30 pounds off through diet or medications or surgery or however you go about it, you are much more likely to keep the weight off if you are physically active and exercising. Walking is an excellent choice. Swimming is an excellent choice. But it needs to be a balance of both cardiovascular exercises or aerobic exercises and resistance exercises, whether it's elastic stretch bands, whether it's lifting weight, whether it is a whole body that combines both, like swimming or a rowing machine. But if you just do cardiovascular exercise, you are not going to have nearly the health benefits as if you have a balanced workout routine that is both aerobic and resistance training.
Okay, thank you. All right, Dr. Alley, medications. All right, we're going to start with those that you take by mouth. What is available out there?
Well, let's start with when we talk about medications. Dr. McBride and I both will tell you that medications are approved by the Food and Drug Administration. So we have already eliminated junk, The folks who take herbal products or think that some leaf or some flower or some whatever is suddenly going to be a miracle. So when we think about drugs, we have an old one that is a fat blocker. It's called orlistat. It blocks about 20 to 30% of the fat that you eat. But we all know if I eat it and it doesn't get absorbed, we know where it's going to end up. So we know what the side effects of this product are, and it's just not very popular anymore. We have a couple of drugs that are combinations. The goal is to change appetite, but neither of those changes what we can consume. Right? And we know that one of our problems is you eat when you're bored, and you eat because everybody else at the table is eating. And we don't have those drugs that just change appetite, don't fix that. And then we have some of the newer drugs, like the glucose-like peptide product, or the glucagon-like peptide products, that are mostly given by injection, but you could take them by mouth.
And how did all of this come into play? I mean, when we talk about these medications to help with weight loss, I don't need a whole history lesson here, but why were they developed in the first place?
Well, let's give just a tiny history lesson.
Fine.
I grew up in Crete, Nebraska. And one of the things that my hometown is most popular for is that's where the Chautauqua would have the fairs every summer. And selling snake oil was pretty popular. And one of those snake oil products was, we can make you look like, fill in the movie star name. And so there are folk who have attempted to look like somebody that their genetics say you can't look like. But they're trying anyway, and they have unreasonable expectations. But now we have determined scientifically that being overweight, carrying around too many pounds, also changes the outcome of a number of diseases. And that's why now you can get us here, because we actually are paying attention when perhaps when it was only vanity, we didn't pay attention.
Okay, so effectiveness. Obviously, we're going to have to make sure that we're talking with folks like you to make sure that things are as effective as they can be in terms of our whole big picture. But if someone were to say to you, well, how effective are these things? What's your response?
It varies, and we even saw in the intro, right? I lost this many pounds, but some people have lost some number higher than that. That's probably true. They are effective, but they will not be effective next week. That is, you can't step on the scale today and step on the scale in 7 days and say, oh, look, I have lost enough weight that I'm changing my pants size and I am bragging about it at Card Club. That's not going to happen. It takes some time, because it took some time to gain the weight. It's going to take some time to make it go away. But they are effective. They are not going to cause you to lose half of your current body weight. They're not. We haven't found a safe way to do that yet.
Okay. Is there somebody who shouldn't even be considering taking these types of medications?
Oh, every drug is a drug because it has side effects and because it has dangers. So we need to evaluate, what are you allergic to? What other sensitivities do you have? And then certainly we have drug-to-drug interactions. When we think about drugs that block things, that means they also block other drugs, which gets to be a problem for us. And certainly there are folks who don't weigh enough. We know that a huge percentage of the American population weighs too much, but there is that small group that don't weigh enough. and sometimes that is an obsession, and we need to be really careful that those people who are losing weight and it's not healthy don't get access to these products and make the system worse.
Okay, all right. I want to shift gears a little bit and talk about injections in the abdomen and these GLP-1s. What can you tell us about that?
Well, I can tell you that that stands for glucagon-like peptide, which for most of us means nothing. What it means is there are receptors in your body. Think of them like light switches. They're either turned on or they're turned off. And by changing the position of the light switch, we change how fast your stomach empties. We change your appetite. We change the way your body controls glucose or sugar. These drugs act like glucagon, a product that your body makes in response to blood sugar, to eating, to all of those things. So they work by moving the light switches into the position that says, I'm not hungry, I do not need to metabolize this quickly, that is, my stomach's gonna slow down, and I'm going to manage the way I store blood sugar. That's pretty much how they work.
So what I'm hearing here is you really have to have committed to this whole idea of process before you would even consider the medication, because to your point earlier, one of you said we eat when we're bored, and we all do that. I mean, we're all guilty of that. And so in your psyche, you have to have really committed to this whole process of, I'm going to do this, I'm going to pay attention to what the experts are saying, and I'm really going to follow this. Yes?
Yes, absolutely.
Okay.
So at Nebraska Medicine, we have an entire center related to bariatrics or weight loss. And I think but we have endocrinologists, physicians who prescribe these medications. We have nurse practitioners, we have physician assistants, we have physicians and surgeons, we have multiple dietitians, and we work very closely with the psychology department, because you're right. I think when we talked about diet and physical activity, and I think the key when someone is saying, do I need the medication, is if you are doing everything you know how to do with diet and physical activity, and you are not getting the weight loss you need to be a healthier person, you need to start asking yourself, is there a stronger tool that will help me? And that's what all of these medications are, is they are tools. And as Dr. Ali mentioned, they are tools that help you not be as hungry. There are tools that help you get full on a smaller amount of food. There are tools that make the food sit there long enough for your stomach to tell your brain, I don't need seconds. I don't need to be eating again in 30 minutes. There are older oral medications that help with cravings. You know, if you are a sweets craver or a salty food craver or a soda drinker, a real soda drinker, and it is those cravings that are constantly sabotaging you, there are medications that can be tools to help you overcome that. And so working with a physician or a nurse practitioner or a PA in conjunction with pharmacists can help you figure out which is the right tool for you. If you've got, you get to the point where you say, I need a stronger tool. I've learned everything. I've worked with dietitians or I've worked with nutritionists, and I need a stronger tool. And then what medication is the right tool? And you're right. I mean, your introduction showed multiple of the GLP-1 medications. There are some differences between the semaglutides of the world and the tirzepatides of the world on which receptors, the on-off switches they hit. And you know, there's another generation undergoing research right now, which is actually going to have 3 different things in it to help with 3 different mechanisms. But they are all tools, and if you don't listen, if you take the tool, but you don't listen to what your body is trying to tell you, as Dr. Ali mentioned, you know, it can tell you you're not hungry, but if you eat because there's a Husker game on, or because it's Thanksgiving, or because you're bored, or you're lonely, or you've had a fight with your spouse, the medicines are not going to physically stop you from taking another bite. And so that's why I am a huge proponent of working within a multidisciplinary program that can help you also with your relationship with food and how you do it. And the Bariatric Center is one option. There are many excellent primary care providers out there that work within their clinics and the dietitians in their clinics who also can help you find the tool that is the right tool for you.
So, and thank you for that. Dr. Ellie, when we talk about tools then, one of my questions here is how long are we utilizing that tool before we realize it's effective? Or, I mean, you know.
I think that generally at 21 days, 3 weeks, we will know, is this beginning to do what we are looking for it to do? For some patients, maximum weight loss is 2 or 3 months. For other patients, it takes 6 or 7 months because it depends on changing all of the other things we are asking you to change. I work with a fabulous physician in the sharing clinic, a process where we help folks who are unable to afford medical care. And one of his pieces of advice is always, do not drink your calories. Don't drink soft drinks with lots of sugar. Don't fill up your coffee or your tea or whatever with sugar. Don't make that lemonade that's half sugar and half water and a little bit of lemon. Don't do those things. Patients who can't stop that, it's going to take longer for these drugs to work if they can work at all.
Is there a concern that once you start a medication like this and you do start to see the results and it takes your 3 weeks or whatever the time frame may be, that people have a hard time getting off of these medications?
Stanford, not the one in California, Stanford did a study that says there are a group of people when you take the drug away, and this is specifically the semaglutides, the tirzepatide, that when you take that away, after about 60 days, the patient, if they've made no other changes in their life, are back where they started. It's not like it's not like developing a drug habit, but you needed the drug to continually do what it does to maintain weight. There are other patients who can stop reasonably easily. They lost the weight, they have made other changes. Think about, I cannot walk up and down the stairs because I'm too heavy. As I lose weight, I can suddenly take the stairs, not the elevator. That's the patient who is going to be able to stop these drugs, right? They have changed other pieces of their life. If you are relying solely on the drug to manage the situation, then no, you may not be able to stop without expecting the weight to come back.
Okay, thank you. Dr. McBride, I do want to ask you, we just have a few minutes remaining, but I think we'd be remiss if we didn't bring in surgery to this discussion. So just a few minutes, what's important for our viewers to know?
So bariatric surgery has been around for 40 to 50 years, and the operations have changed a little bit. But the most common operations being done in the United States right now are the laparoscopic sleeve gastrectomy and the laparoscopic Roux-en-Y gastric bypass. But again, and I've been a bariatric surgeon for almost 30 years, before we had any of these meds on the market. And when I would talk to patients about surgery then, it was still the analogy of this is a tool. We just didn't have medications as that tool in the middle. You had diet and physical activity, and if that was not enough for you, the next tool was surgery. Medicines now are an alternate tool, but surgery is still a very viable option, and I still do several a week for patients that the medications are not a strong enough tool, or the dose of the medication they would need to get the effect they need, the side effects are too significant. So I would say the majority of the patients that I do bariatric surgery on in 2025, and I anticipate 2026, are people that either cannot afford the medications, their insurance will not cover the medications, or they were on the medications and the medications were taken away by their insurance company, and now they're ravenously hungry and their weight's going back up, or the side effects were just too profound. Because with the current GLP-1s, the biggest side effects are severe nausea, severe stomach emptying issues, really bad heartburn and reflux, and then constipation, including I have met patients whose constipation was so bad that they ended up having problems with their colon and needing emergency surgeries. So if you have tried or have been unable to get the medications, surgery is still a very viable tool. And nothing you've done on medications will sabotage your ability to have surgery. And in fact, most insurance companies that cover bariatric surgery require that you work with a program for at least 6 months. So we can take that time you worked with your medical provider on meds and count it towards the 6 months of seeing if surgery is a better and right tool for you.
Okay, talking about healthy weight loss today with Dr. McBride and Dr. Alley. We have like a minute left. I'm going to give you each 30 seconds to talk to our viewers now. Just 30 seconds. Go ahead, Dr. Alley.
If somebody is making the drug that's not the company that was approved to make the drug, it's not FDA approved. So saving $20 or $30, probably not worth it right now.
Okay, Dr. McBride.
I think the important thing is to work with a physician or an advanced practice provider and dietitians to find the right answer for you, because it is absolutely customizable. I spend most of my time talking to people. I am board certified in obesity medicine and I prescribe all these meds. I'm also board certified in bariatric surgery, and helping people navigate and figure out what is the right choice for them is the biggest issue and the thing I do all day long. Find someone who can help you find the tool that works for you.
Healthy weight loss. Folks wanting more information, we're going to go ahead and put this up. UNMC.edu or 402-559-4000. Ladies, thank you so much for joining us, sharing your time, expertise, and your stories. We appreciate all that you do.
It's an honor to
Happy
join
New Year
you.
to both.
Absolutely. Happy New Year to you.
Thanks to our students who are working so hard behind the scenes, and of course, to all of you for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television in the School of Communication. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call the UNO School of Communication at 402-554-2600 during regular business hours. Or send an email to cwyatt@unomaha.edu.